When did you first start noticing cracks in the system or moments where patients simply just couldn't get what they needed despite everyone's best effort?
Even in training through my PA program in the early 2000s, a number of my preceptors and mentors would say things like, America's got the best healthcare in the world if you can get it. I think most of us have experienced it. Me as a patient and as a provider, just making an appointment is such a difficult task. Having appointments not being canceled or rescheduled over and over and over, having messages answered in a timely fashion, getting refills, just the basics, just the most minimal kind of processes have become an effort in endurance and resilience for patients.
What realities about access inequality have you seen up close?
If you don't have a pocket full of cash, you can't really get what you need in healthcare. Let's say you do 5 doctor visits in a year, which is not excessive, and you get 2 prescriptions, each for 12 months, and you spend all that money out of pocket for the policy. You don't get a penny of that reimbursed to you, or none of the care you're about to get in those 5 visits is likely to be covered because you're not meeting your deductible. So you've just spent how many thousands of dollars on a policy that basically just means you're not going to lose your house if you get really sick. You're still going to spend up to $6,000 out of your own pocket.
For patients who are listening who feel powerless right now, what's the very first step they can take to regain control of their care?
That's going to be a lot of people. The first step is to
Welcome to Care on the Line. This is the show where we bring you real stories of patients, caregivers, and clinicians standing up to a system that too often says no. Today, we're kicking off something powerful, a movement for patient advocacy. Our host, Micah Bicker, has spent more than 20 years on the front lines of medicine as a physician's assistant. He's worked in rural clinics, urgent care centers, and underserved communities. He's seen firsthand how bureaucracy gets between people and the care they deserve. In this first episode, we'll dive into Micah's own journey, how frustration became purpose, and what it means to fight for access in today's healthcare landscape. Let's get into it. So nice for you to be here. I'm excited to hear your story and learn more about you and your advocacy. So take us back to the beginning. Where did your journey in healthcare start, and what drew you to medicine in the first place?
I was actually really young when I lost a grandparent and was present when that happened. And I think initially my need to be involved in healthcare was a sort of an effort to understand the process of aging and dying. So I started as an EMT somewhere back in the early 90s and have done a lot of jobs at the bottom of the sort of hierarchy in healthcare, including CNA, for 7 or 8 years while I was working my way through school. I became a PA. At the time, I was actually in the pre-med program, and um, I had a wife and 2 children, and couldn't see myself trying to be a father and husband moving through the PA or through the MD process. So at the time, PA was a relatively new position, and I was excited to be accepted. And so I graduated that program in 2002 at Wichita State University, and have been, for the largest part of my career, in the Midwest, in very rural and underserved areas. Um, so that's where most of it started. I was drawn to rural healthcare, uh, mostly because the need was so great, and the impact. I f- I had a feeling that the impact in rural settings was greater, and that there was a greater community impact, not just a patient to provider impact as well. Just because without people like me in the middle of nowhere, there just is nothing to support healthcare. So, have been very rewarded by my work in rural healthcare, and I've done work with some rural settings here in Oregon as well. I've worked with Indian Health Services, and I volunteered for numbers of organizations that have been uh, working to provide niche care in different places around rural places, and it's just been a very rewarding process.
Absolutely. I definitely different background than you, but my grandfather was super important to me. And after he passes, similarly, when I actually got into healthcare and behind the scenes of healthcare, seeing how broken the system was, dealing with my grandfather and having to take care of him and make appointments. And it was just so overwhelming that that's actually a similar reason to kind of how I got my start into the healthcare realm at some point. So I can
So,
definitely relate to you with that for sure.
yeah.
And through this process of yours, when did you first start noticing cracks in the system or moments where patients simply just couldn't get what they needed despite everyone's best efforts?
Yeah, even in training, through my PA program in the early 2000s, a number of my preceptors and mentors would say things like, "America's got the best healthcare in the world if you can get it." And so, early on in my career, I was aware that part of my job was gonna be trying to get people what they needed, when it seemed hard to do. And, in the last, I don't know, I think it's been difficult all of my career to achieve the outcomes that I know were possible. But I think especially through COVID, where, eh, for right or wrong, everybody became a little more suspicious, a little less interested, on both sides, both patient and provider, in really coming together and really working together. I think that made things very different. I also think COVID made us emphasize working on volume and profit margin instead of quality and care. Now, this is a huge overstatement, so take it for what it's worth. But I think most of us have experiences. Me as a patient and as a provider, um, or just making an appointment is such a difficult task. Having appointments not being canceled or rescheduled over and over and over, having messages answered in a timely fashion, getting refills, just the basics, just the most minimal kind of processes have become an effort in endurance and resilience for patients. And on my side too, as a provider, trying to meet the need is really a challenge. So the question was, when did I see the problem? It's just been a progressive issue. And I think we kind of fell off a cliff in and around the onset of COVID.
Absolutely. Yeah. I mean, I think you said it exactly how I feel about it as well. Just having worked in some sort of administrative roles with healthcare, and then I started working on tech startups to help the broken system of messaging within healthcare. That's actually how I kind of started in tech startups. But it's daunting, it's draining, just making an appointment. And from, like you said, from the provider side and the patient side, and from the administrative side and from the patient side is just so stressful and chaotic and overwhelming. And I would book doctor's appointments at one point in my career, and their schedules were so packed, and there was still so many patients that couldn't get appointments for months, for months. So, and getting a prescription is always just like a, I hope it's there. They said it's there. I don't know if it's going to be there. My doctor said they called it in, but it's always just so stressful. Like you said, the basics. So 100%. I think everyone, like you said, can relate to having some sort of experience with that. And with all these experiences that you mentioned, was there ever a defining experience, a patient or a story, or even your personal moment, something that you went through that really shifted you from clinician to advocate?
It's been sort of a long process. I've sort of had to build sort of a callus, knowing that part of part of my day every day is going to be making telephone calls or asking staff to sort this out or that out, and it's not a small part of my day. If in family practice I'm supposed to see 20 patients a day, I guarantee you an hour and a half or 2 hours of that will be just this logistical stuff. And a number of my colleagues just don't do it. It just doesn't get done. They just can't. I mean, so, but the process of getting to that place where just that frustration and the burden of the nuisance became greater, uh, did lead me to some opportunities with personal friends and family who weren't getting what they need. And I remember one friend in particular who had a job change, and so a mandatory change of her insurance policy, which meant that she lost her primary care and her specialist providers. And in trying to sort of sort out how she was supposed to get through this, and she was a social worker, by the way, at a family practice clinic, who didn't know how to navigate this. And so I started making and she actually had medicine that she required every single day to keep her well. And of course, her previous doctor wouldn't prescribe because she was no longer a patient. And her new doctor wouldn't prescribe until they saw her 3 months in advance. Without her medications, she would have been in the hospital. No question, in a matter of days. So, in the process of championing for somebody outside my clinical role and understanding this is a very intelligent, very practiced, very practical, and self-reliant human, that she needed somebody to actually go to a department in the hospital she didn't even know existed to make the wheels turn was a very big light bulb for me. And I wrote a letter. I sent it to her. She copied and pasted it. She put her own name in. She signed it. She delivered it. And 24 hours later, she had the medicine she needed. And her appointment was rescheduled within a matter of weeks, not 3 months. And it just says to me that if you're not going to advocate, if somebody doesn't advocate, including the patient, then outcomes are going to be remarkably limited and woefully insufficient. So that moment where a good friend was so frustrated and getting sicker by the day, to have it turn around and with me giving half an hour of effort was like, oh, okay, this is how I can help. This is how I can make the difference. This is how I can build a team that does this with me. I can educate people, not just who are going to get direct care from me, but who can be educated by me and become their own advocates or recruit their own advocates. Feels every bit as meaningful as my one-to-one with patients right now.
Absolutely. No, that's amazing that you were able to have that experience and then turn it into something else where you're, for example, saying you have your team and it's just like that made me think of again with my grandfather when he was in the VA home and he was a veteran and he was 95 and he was also 95 but sharp and he'd made his appointments for up to like 94 years old and he would be on the phone all day and scheduling this and scheduling that and doing all this and he would eventually navigate it, but when he was in the VA, I was his advocate and I would not get responses and I was going through these circles and I was in the VA hospital walking up to offices and saying, "You're gonna help my grandpa, you're gonna do this, I need this done." And I had that physical experience to be in one place to get that done. And even that was difficult. And I was just like, I'm gonna be his advocate and figure it out. So I completely get how even a short interaction like that can shift your whole mindset completely, completely. So that's just a memory that while you were speaking, it popped into my head because I remember that. I was like, I am going to be your advocate. And in nursing homes, when I was with him in the nursing home, same thing. It was like I had to advocate, and they even will tell you if you have a good provider or someone in the healthcare industry, they will say you have to advocate for someone else that you're taking care of or yourself, or things will fall through the cracks and things just won't get done, or they'll get done in very untimely fashion. So I totally, totally get that.
Well, and your
And
circumstance, your experience is in no way unique.
yeah,
Every single human who has tried to access
yeah,
Western medicine in the last 10 years has had this happen.
yeah,
It
absolutely. It's everyone can relate.
right. It takes you
Everyone.
15 minutes to check in. Why? Why can't you just say, "I'm here for my appointment," and be done, right? There's 20 questions, there's 3 or 4 forms, there's I don't know, we have built in so many barriers for so many reasons, and we don't even acknowledge them as barriers when we're providing care. But as a patient, when I'm third in line listening to the same questions, and these people are they're questions that not everybody wants to have in the waiting room, right?
Right.
Even though we've got these HIPAA protections and whatever. Just the act of becoming engaged with healthcare is a series of stops, and somehow those have to go away, and somehow I have to be involved in that.
Absolutely. That's incredible that you've taken that initiative for sure.
Thank you.
And you've worked in rural communities and underserved communities for so long now at this point. So what realities about access and inequality have you seen up close?
Well, it is absolutely true. If you don't have a pocket full of cash, you can't really get what you need in healthcare. That's an overstatement again, and a generalization, okay, but it's true. And what we're facing now in just the next several weeks with our current government situation means that like, even let's say you're on the ACA, the Affordable Care Act, right? And let's say you've got the bottom tier plan and your deductible is $6,000 this year and your copay is $50 for or $25, whatever. But you've got a copay and then you've got copays for your medications and um, let's say you do 5 doctor visits in a year, which is not excessive, um, and you get 2 prescriptions, each for 12 months, and y you spend all that money out of pocket for the policy. You don't get a penny of that reimbursed to you, or none of the care you're about to get in those 5 visits is likely to be covered because you're not meeting your deductible, right? Or some small percentage will be. So you've just spent how many thousands of dollars on a policy that basically just means you're not going to lose your house if you get really sick. You're still going to spend up to $6,000 out of your own pocket. You're still going to spend some portion of those visits out of pocket. What we have is if you don't have that cash in the bank, you don't go. You sort of self-refer out of the system. You tolerate whatever process is not okay until it's not okay. And then it's very, very expensive, right? I'm currently working part-time in an emergency room where I see this kind of failure where people don't have the copay, can't afford the $2 for their medicine, and they show up in the ER for a $10,000 visit when the crash pieces come crashing down. And the wealthy who can afford quality premium insurance with lower deductibles and little or no copay, those folks consume healthcare differently, right? Or if you can afford a concierge physician service where you're paying monthly, a small price monthly, and then a little extra when you use the service. If you can afford that, or you even have access to it, because those are not easy to find, then the way you and healthcare interact are very different. The way you get tests, the way you get therapies, the way you have medications delivered to your door. It's a very different process for people with means and people without. And so the hugest inequality, and yes, there are absolute issues around visa status and uh, sort of ongoing things. And I don't want to make this a political issue, but there are absolute race and gender issues that come to play. There's no question. Um,
So,
and I don't know what to do about all that necessarily, but the key here is access. It's just access. It's opening the door for everyone. And we all have the same color blood. We all have this very similar anatomy. There's no reason that patient A should have access that patient B doesn't. Um, the inequality largely, and what I think we're going to see just a ton more of very soon, is financial. Um, and so I'm really working on doing something that, again, educates for free or for very little, for providing resources that are free or also very little, it won't cost much to access. Um, and building an educational platform and process for patients so that they can step into this hole where no one else will join them and get and work to get what they need in a way that's meaningful, um, and that augments their care as opposed to pushing them further away.
Absolutely. Absolutely. And it's like, I'm sure you've heard this a thousand times. If someone's injured or someone's hurt, the first thing people think of is to call an ambulance. But if you're the one hurt, the first thing you say is, never mind. Like, someone will drive me. I'll figure it out. Do not call an ambulance. I do not want to pay $2,000 to get to the emergency room. And it's so sad that that's how we have to think about our health and getting help that we need, especially in emergency situations. And you mentioned a concierge practice, and I worked directly with a physician at a concierge practice, and it was a very niche concierge practice where he actually went to people's homes, and I have never in my life witnessed anything like that. He treats, I guess, whoever can really afford him, so the top 1% of the elite wealthy people in Manhattan on Midtown East. So I saw a whole nother realm of healthcare and how people live, and it was just jarring after previously working for Cornell when I people are trying to get their OB, they're pregnant and they can't even get in contact with their physician for
Huge
weeks.
problem. And a
And I
growing.
had to relay it and feel so bad. So,
Right. And I'm not saying that you that if you have them means you shouldn't use them. There's no judgment in my saying that the access is
mm,
there. The problem is that we have failed collectively as a culture, as a community, as an industry to actually see the patient as the consumer, to see the patient as the product, to see the patient as our customer.
mhm,
Um,
absolutely.
our insurance companies have become our customers. We do,
Mhm,
and I didn't even intend for it. It's not a conscious process. Your doctor, your nurse practitioner, your PA is not sitting around thinking, "How am I going to make money for Blue Cross Blue Shield?" That's not happening. But when I'm seeing a patient and they've got a sore knee or they've got a shoulder problem, my question is, what are the criteria I need to get an MRI? And if I get an MRI and it shows something real, will this patient be able to access therapy, or will this patient be able to access a surgeon, uh, or whatever? I mean, I'm thinking along what will the insurance pay for the entire time, every step of the way, including medications. Like, they'll pay for Tylenol and Advil sometimes, but that's over the counter, so maybe not. If I prescribe something, will it be covered? Probably some, but maybe not. It's just every single decision I make is about insurance companies. Instead of every single decision I make being solely about what's best for my patient. The 2 are almost
absolutely.
never the same thing. And very frequently I have to come down somewhere in the middle. It's a huge compromise I have to make. We have to make collectively all the time.
Absolutely. And like you said, insurers almost really became like the real customers, right? So when you mentioned that and you touched on that, how did that realization hit you emotionally as a provider?
Oh, I'm just angry. And, the anger is sort of this cover up for a frustration and maybe a sadness that, um the folks that run this economy, the folks that keep the doors open and keep the floors clean, and uh, the folks that transport everything, the folks that grow things, uh, the folks who are producing the things that we buy are the last consideration in the process of how do we make these people well, and that includes that person and their parents, and that person and their children, and that person and their neighbors, right? And um, Uh, I'm not sure how we've entirely lost sight of every provider that you see is full of compassion. I know so many providers who went into healthcare to really make a difference and be with people and help people. You just can't be that person and and make any money, uh, or meet the margins or meet the demands of your industry. And it's just frustrating. It's just frustrating. It's infuriating. There are people with treatable disease everywhere that are becoming a bigger burden on us in the ER and other places, that with effective early care wouldn't have to. We can so easily reduce pain, suffering, disability, morbidity, mortality. We can impact those things dramatically right now if we give access, if we get access. And so you can probably hear the energy in my voice. It is so easy to do better. Grammatically, I understand the problem with the syntax there, but it's just so much easier to do better. And we can't. We just can't under the system we have.
Absolutely. And there's so many barriers, right? But from your perspective, what are the biggest barriers that patients face today? And not just denials or small frictions that add up.
Well, there are a number of frictions. But again, just as simple as making a phone call to check on a prescription. You don't get to talk to a human. You don't get to control where your phone call goes. You press 1 or 2 or 7 and hope somebody gets it and does something with it. So just the first touch, checking into a clinic, it takes 20 minutes, and then the doctor's 40 minutes behind, and you're calling in late to work, or you're calling out early from work to get there and do the work. And so you're there, but and then every single thing you need, every single thing, every single prescription, every single referral, every single anything becomes uh, a frustration. And let's say you're working 3 jobs and taking care of 2 kids. When are you going to get this done? When are you going to sort this out? When are you going to get to the pharmacy? Right? If you're geriatric and have zero experience with computers or technology in any way, how are you going to navigate a system that is entirely electronic now? And I can't begin to share with you how many barriers that the Western healthcare system has built in. The bigger piece, and that has nothing to do with insurance, just trying to deal with your insurance company if something gets refused. If a claim gets denied, how do you repeal that? Good luck, right? And so these are all different ways we're burdened and barriered. One of the things that happens then is that our population has had a collective development of helplessness, a learned helplessness. It's not happening. I can't get through. I'm just not going to get my medication this month. I'll have to wait till my next follow-up to get my medication, right? Or doctors frequently say you can't get this until you do your labs or get your weight checked, whatever. But then you can't even do a nurse visit weight check for 3 weeks. Like, okay, but then the patient says, okay, I can't get in, I can't get in, I can't get in. And they quit asking and they quit trying and they quit pushing until things get really, really bad. And that's when patients finally start to say what it sometimes will come out of that place of helplessness and sort of push forward. Um, and even when patients are with me, they know not to ask. So I don't get the full story. Oftentimes I'm not told how badly something is needed because they just don't think they're going to get it. So despite my training and hopefully my capacity with questioning patients and being involved in the interview, I don't often appreciate, because of their helplessness, what they need. So we've not just provided a very inferior process and product. We've developed a consumer that expects it, all of which is entirely embarrassing and completely reversible.
Absolutely. Absolutely. And what do you think that patients misunderstand about their own rights in this process?
Even as I encounter around family and friends, they're not aware of they don't know what to ask for. They don't know what's available. They don't know about the technology. They don't know about our thought process when it comes to how do I choose which test? How do I uh, choose which doctor? How do I choose which referral? How do I choose the medications? They don't have anything. They don't have any idea what's going on in my mind or in the insurance world that says what's available, what's not. So oftentimes they don't even know what to ask for. And um, then when they do ask for something as simple as a test to help them understand what's wrong, and they get it, they're actually kind of flummoxed. Oh, wow, I could do that? Who knew, right? The patient side, the barriers are, number one, I have to take time off out of my life, and most patients don't have much.
Right.
Every time I touch medicine, it's gonna cost me something. Because even things like refills now are being billed, right? So every time I touch healthcare, it's gonna cost me cash that's post-tax dollars mostly, that I'm needing to be able to feed my kids and put gas in the car, right? Those are real choices people are having to make. So there's a financial fear, there's a fear of rejection, there's an understanding of just a lack of interest or capacity on on the healthcare side to be involved in their wellness. Just a lack. So it's a huge process that we've built as sort of we've buried people under this avalanche, right? And heaven forbid someone says no, and now you got to appeal. That's a whole nother process that you're going to lose statistically.
Absolutely. And it's so complicated and complex to even navigate those things.
Yeah, and if
It's
you don't
overwhelming.
right, and by the time it's gone through a broker and an insurance company and been kicked back and sent to someone else, you don't even know who you're supposed to talk to, and neither does anybody on the other end of the line. When you call, they're like, "Oh no, this should be sent to here. Here's the telephone number," and you get the same whole thing. Where if you've got a $3,000 bill that's been rejected, you're going to spend 20, 30, 40 hours sorting that stuff out on your own, and you're probably still going to pay the bill.
And you get ping ponged, like you said, between people. This person tells you to call that person, and that person sends you back to this person, and
And it's
it's just a
intentional.
cycle.
It's entirely
Mhm.
intentional. It's designed that way. It's absolutely
Absolutely.
designed that way. So,
Right, because they just want you to give up and pay it and not
right,
go through the process for sure, 100%.
absolutely.
And when we talk about the US healthcare system, right, if you could describe it in one word or image, what would it be and why?
Mm. Oh man, one word. Well, chaos absolutely comes to mind. Um, and I guess I'm trying not to use a word or something that might be really overly dramatic or hyperbolic, but this is designed. This is designed incompetence, where you take some of the brightest minds and the best souls and the most giving hearts, and you put them in a system and make people think that it might actually work, and then make it impossible to work while a very small group of people and organizations make obscene money. It's 1984. How in the world is it anything but dramatic, right? Um, so one word would just be on the patient side, chaos.
Absolutely. For sure. And I completely, completely agree. I think everyone would agree with that word choice for sure. And when you talk about patient advocacy, what does that really mean in practice? And what does it look like on a day to day?
Yeah. So what I'd like to do is both personally and with the team I'm building, I would like to give people access to there are some channels that you can sort of get into in healthcare that let you navigate the barriers. So if you're not getting what you need, it or if your insurance is denying it and your primary care isn't pursuing it, okay, what's next, right? Um, I'm hopeful that I can provide a series of things like downloadable documents, letters that you can send, and with direction on where to send them, because it's not always the insurance company and it's not always the primary care doctor. But I'm hopeful to be able to provide documents that you can download, that you can fill out, that you can add your name to, that you can sort of add, I need an MRI or I need physical therapy, that you could sort of customize on your own, that you would be able then to send on in your own process. I'm hopeful as I make more and more content that people hear, oh, this person did this, called this, did this series of processes, got what they needed. And that sort of thing can be something relatable and usable by somebody who's not necessarily following me or spending money with me. The third kind of process I'm interested in is providing an advocacy program where you can contact me or members of my team, and we play 20 questions with you. We ask the questions that are, we address the issues that are most bothersome and most limiting for you as a patient, and or provider. Even if you're having trouble navigating stuff, I'm happy to help you too. Um, but where you contact me and for some arrangement, me and my team step in and work to navigate the process that is being a frustration or a limit for you and your patients. That's the third step. So 3 distinct models. One, um, uh, we'll give you some tools that you can download and use for free or inexpensively. 2, the content hopefully will empower. 3rd, I'm building an organization to be an advocacy process for both patients and providers. Now, as part of that business, I would like to develop curriculum so that other people who want to do this advocacy work can, and so that it can be disseminated without my hand holding or spoon feeding anybody for the process. I have developed quite a bit of history and experience in doing this work, and the team members I'm working with have been career involved in doing this kind of work as well. So we have different ways to punch through the glass, and um, I do think governmentally things are changing very quickly. So we're going to have to be very spry, and we're going to have to learn new things and interesting things, and we're going to change our methods probably along the way. And I think this process of bringing people in who need the assistance will give us opportunity to really learn how it is that over and over and over again, our efforts are rewarding. It's going to be a process.
Absolutely.
Yeah.
Definitely, but definitely needed. And it's incredible that you're doing it. Like you said, it will be a process, but it's so needed. And hopefully it will be such a change and really, really a solution for so many issues and help for so many people for sure.
Yeah.
And
See.
for hopefully, and I'm sure it will be. And I think that this podcast is so helpful because it is spreading that information and spreading that this does exist and really helping people to navigate it and to reach out to you to be a resource. So I think it's great that you're spreading this to everyone and for all of our listeners
Yeah.
and for patients. Mhm.
Well, I really hope that learned helplessness that I began to talk about um, is something that we can start to change as well. I don't know. It's a huge, huge ship to turn, and it's time to start turning it.
Absolutely. No, absolutely for sure. For patients who are listening who feel powerless right now, what's the very first step they can take to regain control of their care?
That's going to be a lot of people. The the first step is to not stop. Do not stop asking. The people, when you're calling your providers, when you're calling the insurance companies, they the providers for sure want to be helpful, and they don't mind accountability as long as you're kind. Um, but ask questions. Ask why not. Work to get on the phone with a human. Use your MyChart account. Ask why. Ask why not. And if you need help, feel free to reach out. One of the ways, I think, one of the sort of ways I'll be producing content is to be taking a patient's story or many stories over time and going through, okay, this is what the patient is facing. Here's what we're going to do. And then coming back and saying, here's what happened. And in that step-by-step process, giving people additional outlines of how they can be helpful in their own process. But I guess if I just want to say to you, as my neighbor, my friend, my family member, even the person who checks me out at the grocery store, if you've got a problem you're not getting answers to, keep going. Um, and one first step is to ask to speak to a nurse manager or to a clinic manager. And I'm not saying that you need to be in someone's face. I'm saying get a human who has answers on the phone. That's what I'm saying. That's what you ask for. Now, there's still going to be some,
Absolutely.
there's still going to be a significant chance you won't get those folks on the phone, but start asking for those folks.
Absolutely. Even if you have to try, and like you said, it might not be easy to get them initially, or maybe you will, but definitely keep trying for the manager or the nurse, like you
Right.
said, for
Your
sure.
problem is a valid problem. If it is concerning enough that that you need the answer and you're not getting it, please gently keep trying. I will say too that as a provider, if you are in my grill or if you insult or hurt my staff, my the entire system will change and work less
Hmm.
well for you.
Right.
You know, I may earn that kind of energy. That's something that does happen. If I get that energy, my response to you may not be as helpful. Just be
Right.
aware. That makes sense,
I
right?
think absolutely. When you said that, I had that same thought about being consistent, but being nice, because being nice also does go a long way. As someone who's worked in a call center,
Well, you
trust
can
me.
even one of my favorite things to tell patients, um, I learned this so late in my career, but one of the things I ask all of my patients, or most of it, I try and remember to do this, but at the end of my visit with the patient, it's my question to the patient is there anything that you need to say that I haven't heard? And that opens a lot of doors. But what the patient can then do, instead of waiting for that question, which may not come, would be to say, Doctor, I don't think you heard me, or I don't feel heard. I don't think you understand how much this affects me. I need you to understand something differently. But those very gentle and direct and supportive comments are about you. You're not attacking anybody. I don't feel heard. I don't feel seen. I don't feel understood are great lines to begin a conversation about what you need. And oftentimes, you know, when I was doing urgent care, and I've done a lot of urgent care, I literally would see 45 or 50 patients in a 12-hour shift. And I had to chart all those things. And I had to send for prescriptions. And I had to communicate with other doctors. And. So if you do the math, if I'm seeing 40 patients in 12 hours, it's very likely you only got 7 to 10 minutes with me in the room. Now, the odds are I didn't hear everything that would have been helpful for me to hear, right? So at the end of your visit, on the phone call, when you're messaging it through my chart or other agents, other ways, I don't feel seen, I don't feel heard, I don't feel understood, are great opening lines. And then you carefully say, what I really needed to say was, what I really need you to hear is, what I really think I need from you is. That's a gentle and direct way that a provider can really engage with you. So do
Absolutely.
those things, I think, as a first step is probably more than most people do.
Mhm. Well, absolutely. And I think that's such a good way to even end that appointment and really make sure that those thoughts are communicated and clear to you. Because it's true, a- as you know, you think of doctors and it's like almost you expect them to do everything and be all of these things when they're people too, and they're busy, and they're, like you said, they have to chart, you have to send in prescriptions, you have a million things going on. So that reiteration at the end, I think, is very, very key for sure,
Well, and
and
if you're a
smart.
provider, one sure way to make your life simpler and reduce callbacks, reduce additional messaging, reduce headaches after the fact is to say, is there anything you need to say that I haven't heard? It's
Great.
it's amazing. In one or two sentences, you'll have a different picture and a different opportunity and a way to close a lot of circles that make a big difference for everybody.
Absolutely. No, I think that's great advice. Absolutely. And let's paint the vision a little. So, if advocacy were built into healthcare from the start, how would the system feel different for both patients and clinicians, do you think?
Oh, that's a powerful question. I think patients would walk out of the clinic feeling like their life, like the process is promising, like the outcome is worth the effort, like they have partnered with somebody who cares. And I think on the provider side, when at the end of the day or at the end of a visit that's emotionally full, um, that as you're closing those loops and fulfilling promises and making sure things are done well and completely, that the mission that we get out of bed in the morning to serve has been served. One of the hugest problems we're facing right now is provider burnout. There, there are only so many people doing the work for a number of people that has not really changed, for a number of patients who hasn't changed. And it's the systems and the democracy. I mean, the number of providers versus the number of administrators that we see in hospitals over the years. We've got so many more administration kind of processes than we have people that they're administering right now. Anyway, that's part of the frustration, right? But people are
Right.
leaving healthcare. People are
Mhm.
leaving healthcare. We have known about a nursing shortage for years, and we have even the fresh new nurses that are coming in are leaving. I'm not sure what most recent data says, but um, I think ER nurses have careers of less than 8 years after 4 years of training. And they're stepping outside those very critical roles to do other things. And some in medicine, but many leaving medicine entirely. I mean, this is how
Absolutely.
we're treating our people that go into healthcare with very real intention about helping. So there's a lot of this that requires reform, not just in the patient provider piece, but the entire system, right? So anyway, there's not enough people to do the work. There just isn't. Um, and so even the folks that show up are behind the eight ball day one. Um, so the I think part of this is if we want to keep healthcare running, we have to give these people opportunity to be successful. And so much of the time, there is no sense of success.
Absolutely. It is. I completely agree. And as you said too, when you go into this career, it takes so much time and effort, and school is expensive. So you really have to care and be driven to get into this field for it to almost break you down to the point where you decide to leave and do something else because of how chaotic it can be. So it's definitely interesting to think of it from a provider standpoint as well. So I think that this advocacy that you're doing and s- spreading this awareness and education is so important. So thank you so much. And thank you for sharing your story and your experience and for really setting the stage for what Care on the Line will be and what this podcast is going to share and explain and talk about. It's going to be a place where patients learn, feel seen, and find solutions. So, if today's conversation resonated with you, to any of our listeners, I'm sure it did, share this episode with someone who's navigating the healthcare maze through chaotic times. And you can definitely learn more. Continue to follow the podcast, and you can follow Care on the Line whenever you listen to our podcast. And the website to visit is careonthelinepodcast.com. Thank you again so much. And I don't know if you have any closing words, but I'm so excited to continue this and have more episodes. It's so relatable. I feel like I'm learning so much, and I'm sure all of our listeners are as well.
Thanks. Well, and I've been really well behaved today. I will say I've been really well behaved today because there's a big part of me just wants to get inside and I don't know, to be in the right office, say the right thing to the right people right now, and just say, "What the hell? What did you do? What have we
Mhm.
built? What is this?"
Right.
And the people I want to talk to all have good insurance. They all do. These are politicians. These are policymakers. These are upper levels of administration. The folks that I would want to talk to don't have issues with access to healthcare, not even a little bit. And
Mhm.
holy hell, what have they
Yeah.
built? And how is it you show up to work and you're proud of what you do? I can't imagine that being the case. And
Yeah.
so, anyway, there'll probably be times in my presentations where I get a little sideways and a little energetic. And okay,
Good.
I'm
Let that
that's
let
from
that
here.
passion.
Just beware, that's going to happen.
No, I mean, I think everyone wants to see that too, because I know even talking about this topic, which I haven't particularly talked about or worked in directly in quite some time, I'm getting
Yeah.
angry myself with my experience with being a caregiver and being a patient and being in the background of healthcare in some kind of administrative level, and then working directly with doctors. And I've seen all different realms. So I've seen like the elite who have easy access to care, and I've seen, like I said, I'll never forget this one lady who was pregnant and could not get an appointment with her OB. And I think about it all the time actually. Like it like will always be a core memory of my time working there, and it's so frustrating, especially when you're passionate about helping other people and you're especially dedicating your life and to work in healthcare to help people, and then to feel this frustration. I can't only imagine how frustrated you would be, for example. So I get it. And I think everyone listening will get it as well, for sure.
If you've been a patient anywhere for any piece of time, you've got this frustration. And you've earned it. It's totally, you came by it honestly. And um, as frustrated as I am, I have to really dial it back because I can't be this energetic in complete forms. And I can't be this energetic and be okay on the phone when I'm trying to get something approved. I mean, at the same time, it's just, what the hell? So,
Hmm.
anyway, maybe
Absolutely.
healthcare on the line, comma, what the hell is a more appropriate title.
We can bounce that idea off. I personally like it. I'm a fan. I vote for that. But no,
It
I think
could be a little polarizing, but okay. And again, I want folks who want answers. I want to work with people who want to push. I want to work with people who really want to set up alarm bells. Like, oh, guess what? We actually have to be accountable for this. That's where I want to take this. I mean, eventually it would be nice to have a big enough presence and voice to be able to speak with policymakers and people who are in management that could make changes to policy, including politicians. I would like at some point to be impactful enough to be able to sit down with people who are those people and ask questions that are not easy to answer.
Mhm.
You know, I would
Absolutely.
love to be that person in this world. So anyway, we have goals and
Absolutely.
we're planning processes and let's go. Let's just go.
It has to start somewhere, right? So I'm
Yeah.
happy that I'm along for this journey in the early stages, because I want to see where this goes and how far it goes and how far you take it, which I know we're on to, something great, and it's really just the beginning, for
Thank
sure.
you. I'm eager to make that happen. I appreciate you being along.
Absolutely. I'm happy to be here. All of our listeners, this is just the beginning. This is the first episode. So stay with us. We're going to see what changes from now and moving forward, and stick along for the journey. This was just the first episode of Care on the Line, and we will see you for the next episode shortly.